Minister of Home Affairs and Information, Honorable Wilfred Abrams, Member of Parliament. Permanent Secretary in the Ministry of Home Affairs and Information, Ms. Yvette Goddard. Deputy Permanent Secretary in the Ministry of Home Affairs and Information, Mr. Curtis Jokes. We would also like to acknowledge those online, respective permanent secretaries representing the Ministry of Home Affairs and Information, inclusive of the Barbados Fire Service, the Barbados Government Information Service, the Barbados Postal Service, the Barbados Prison Service, the Department of Emergency Management, Government Industrial Schools, the Immigration Department, we also have representatives here, the Meteorological Office, the Probation Department, and of course, the Chairman and respective members of the Board of Management of the National Council on Substance Abuse. We also wish to acknowledge present with us today, the Chairman of the NCSA Projects Outreach and Fundraising Committee, Dr. Ronald Chase, our feature presenter, Dr. Jonathan Yearwood, who is the Research and Information Officer here at the National Council on Substance Abuse. We would acknowledge, of course, our manager, Mrs. Betty Hunt, our Deputy Manager, Mr. Troy Wickham, and of course, respective heads of departments of the Ministry of Home Affairs and Information, staff of the National Council on Substance Abuse, members of the media, ladies and gentlemen. I am pleased to now invite Dr. Ronald Chase to deliver the official welcome at the pilot online survey report on the perceptions of public workers about drug policies, knowledge about drugs, and drug information intervention services. Dr. Chase.
Good afternoon, everyone. Good afternoon. As protocol has already been established, I am here to formally welcome you to this dissemination of our workplace-based survey this afternoon. It was out of the theme of the caring and the focus on our community. And the workplace is a place, and a very vital and important place within our community in Barbados. We speak about caring for each other, we speak about family, but we also need not to neglect our work family. And especially in these times, within the last couple of months, weeks I should say, where we would have heard about a lot of sad news, it is important that sometimes we take a little time out to consider our neighbor, our workmate, our work colleague. This survey that was done to collect data on the use of drugs, the perception of drugs, even the knowledge base of drugs of persons in the workplace. Mr. Yearwood will come to speak more on the actual survey in terms of the purpose, the objectives, what are our findings, what are our conclusions. But as we are here gathered, I think it is important for all of us to give ourselves a moment to applaud ourselves for one being here, one being alive, one being healthy at some level. I welcome all of you in person and online as we here to listen and to really help us to help our community be better through research, knowledge, and practice. Thank you.
Thank you, Dr. Chase, for that very encouraging set of thoughts and that warm welcome to this forum. And certainly the NCSA throughout this year is highlighting the workplace. Our workplace, our future, our workplace is our theme for the year 2023. And certainly the gentleman who is at the helm of the Ministry of Home Affairs and Information is indeed a steward as it relates to ensuring that we collectively do our part and fulfill our respective mandates. As there are 9 workplaces under his portfolio, he certainly is more than well placed to now deliver remarks at this virtual release of findings on the workplace survey. I now invite the Honorable Wilfred Abrams, our Minister of Home Affairs and Information, to deliver his remarks.
I smile every time I come here because I'm a very lucky minister. I have a lot of high-functioning departments under my ministry. I often listen to colleagues, I'm not going to call any names, lament at some inefficiencies in their own ministries. And while we may have some, I think by and large, we're lucky in our ministry with the departments we have, with the SOEs we have, with the personnel we have, and with the projects that we have, that we get to be in a position often to go to the public and not just share thoughts or policies or abstract concepts, but to share results and actions based on those results. So, having said all of that, I'm glad to be here. At today's event, the NCSA is fulfilling one of its much needed mandates, which is conducting research on the local drug situation. Today's event highlights the disseminations of the findings of the workplace survey report. At the beginning of the year, I announced that the NCSA's theme for this year is Our Workplace, Our Future. Our future, our workplace. We are all aware of how critical employee well-being and engagement are to maintaining productivity. Anything which affects productivity affects the wealth of our nation, and we must therefore seek at all costs to protect the health and wealth of our nation. Protecting the health of our workspaces includes finding out the nature of the problem and then providing solutions to fix them. Therefore, the dissemination of these findings from this report are timely and will be used to inform actionable programs and policy initiatives to deter drug use among members of the workforce. This data is important for creating the necessary programs to help persons who misuse drugs find their way back to a healthy lifestyle. And it's important that we remember, find their way back. We do not give up on anybody. If you were here before and you are now lost, it is our duty to bring you back to where you were or in a better position than when we started. It is also important to implement these programs in an atmosphere free from judgment and harassment, with a balanced structure that addresses the key issues and offers practical and effective tools to ensure that employees maintain or regain good health without abusing drugs. I go again, free from judgment or harassment. That phrase must be critical to what we are about. Nobody wants to know that they have a dependency issue. Nobody wants to be stigmatized because they have a dependency issue. And quite often, it is actually the fear of judgment or the fear of people finding out that prevents people from actually coming forward and seeking assistance. Before I go all the way in, I'm going to tell you something that happened 2 nights ago. There's a friend of mine who has an issue. They've had an issue for a while. Things got to the point where they could not possibly hide that issue anymore. Anybody looking on, even with impaired vision, could tell that all was not right. They continued to deny for quite a while because of the position they hold, because of who they were, because of where they come from, because of where they live, because of where their children go to school. For all of those reasons, they did not want to step forward and do what was necessary to get treatment. But sometimes you hit rock bottom for a reason. Sometimes you hit rock bottom so that you can know that the only way to go is up and that the options are taken from you. You cannot go any further down without losing everything. And in that case, the way is up. Now, all of a sudden, it becomes clear. There's only one direction to point in. But that person got to that point because of the fear of judgment and the fear of people harassing them. We have to be careful as to how we approach people with dependency issues. Persons who may need help but don't know how to ask for it. Right? We all know, come on, we all have done it. You see somebody who is down on the luck, and you're like, Kadir, he used to be a lawyer. He used to be a doctor. He had a family, but everybody left him. From the time you start to go that route, right, that person does not want to lean on you for anything because you have already judged and appointed yourself the savior. So I've deviated to make a point. As we move forward with the NCSA, as we move forward in our workplaces, as we move forward with our friends, substance abuse is a sickness just like cancer. It's a disease just like heart disease. Those persons are effectively patients who need to be treated, not to be judged. So the findings of this survey are particularly interesting to me because these findings allow me to take a second look within my own ministry to see how I can better put a framework in place to address concerns relating to drug use, which staff of the various departments of my ministry may have relating to substance use or misuse and their issues in the workplace. I am not saying anybody has an issue. I am saying that I starting with me. And I'm starting PS with our ministry. Let us look around and see who it is that needs the intervention. We are well placed by virtue of having the NCSA under our portfolio to judgment-free and harassment-free offer solutions to those who need it. This study focused on the following: the prevalence and incidences of drug use, attitudes towards drug use, the impact of drug use on work performance, access to treatment for drug use, and the knowledge and harms of drug use. The NCSA survey will serve as a precursor for further studies to investigate substance use and abuse in the workplace. International studies have highlighted that rates of alcohol and drug use are different across industries and occupations, affecting all classes of workers in a similar way. Anecdotal evidence locally suggests that persons who work in construction, service industries, and the protected services have higher rates of alcohol and substance use disorders and medical conditions characterized by an uncontrollable use of alcohol or other substances, and this despite the known negative consequences. In addition, depending on the profession, factors like loneliness, work stressors, long hours, and pain put some individuals at a greater use for drug and alcohol misuse. At a greater risk for drug and alcohol misuse. If we as a country were to have an entirely honest conversation, we all know that alcohol plays a very big role in the history and the culture of Barbados. You all know the saying, the rum that invented rum. Y'all never heard that? You know the saying, all is... We know them. I mean, we make fun of them. There's so much a part of what we do and what we say that we have absorbed it pretty much into mainstream Barbados. So, as a result, alcohol use in the workplace is linked to a culture that supports alcohol use as a normative behavior, which is applicable and acceptable to many organizations. We all associate rum drinking with cricket. I think it was ESF Fields that had an acronym. Every Saturday after feeling, I end up leaving drunk. I mean, We even went so far as to give that long, long one, right? But we associate alcohol consumption with crop over. We associate alcohol consumption with facts. When you were a child, you look forward to getting old enough to go to the drinks free at whatever club you're going to because you just have to scrape out the money and then you could get yourself blind drunk. And this was a rite of passage. I mean, that's the reality. If we're having that honest conversation with ourselves, alcohol use and excessive alcohol use is a source of pride for many people in our country. People will come in crop over season, get to work, they can barely keep their eyes open, and they tell you how blind they get last night. They may say, well, I don't recover as quickly as I did when I was younger, but I here at work. Don't mind that you're here at work and you can't function, and you're here at work driving a forklift and putting other people at risk. The fact is, as far as you're concerned, you get to work. You did what you're supposed to do. So while this is consistent across several occupations, international research indicates that the prevalence of risky drinking seems to take place in male-dominated industries where the workforce is over 70% male. So we choose the one area to overachieve in. I also recognize that we're on the cusp of crop over, and the activities during this time of the year, afterwards socializing among staff, often involves going to a favorite lemon spot or a bar or somewhere else to have a drink, or two, or three, or four. And before you realize it, several rounds have already been shared. And this is not just confined to weekends. Everybody knows that they got a real big event. Today is Wednesday. It will have thousands of people at it. And we know what tomorrow is going to look like for a lot. I was about to say a lot of us. But a lot of them. And you see the potential negative impacts on the following workday. One of the most popular breakfast parties in Barbados occurs on a Friday morning. And half of Barbados takes the day off. They apply for the vacation. Some, if you could get away with working shift, you will go to the party in the morning and crawl into work in the afternoon. But this is normal because we have accepted this as part and parcel of who we are. The cognitive, emotional, and behavioral impairment that results from drug or alcohol and substance use can affect productivity, morale, and even the safety of workers. The cost of addiction in the workforce is usually measured financially, but it can also refer to more subjective losses which can change the entire nature of an office. I alluded to it before. The consequences of a lawyer going to work drunk are a lot less severe than the consequences of a surgeon going to work drunk. Or somebody operating heavy-duty machinery, or somebody working in a factory, or somebody charged with saving lives like an EMT, a fire service person, or a police officer. We have to be more serious about this, and this is the perfect time for that message to get out. In Barbados, their studies focus on drug education and treatment in the general population, but there are little or no studies focused on addressing drug-related workplace issues and their links to worker productivity. However, based again on anecdotal evidence, and we will only have the anecdotal evidence until we do the studies, I would venture to say that the presence of drug and alcohol misuse in the workplace is a more common problem than many realize. Much like alcohol, the use of illegal drugs in the workplace can lead to the same impacts, such as absenteeism, loss of productivity, and workplace injuries or fatalities. Unlike alcohol, though, many of these substances can be abused whilst on the job without co-workers or supervisors noticing. This includes the abuse of prescription medications, which may impair a person's ability to function, think clearly, or operate equipment or complete tasks necessary to their job. There is also some research that supports the notion of stress-induced substance use, which may come from work overload or job insecurity, while highlighting a positive correlation between stress and alcohol and drug misuse. So even if we only factor these very few reasons, the findings of such a survey can help inform how we can be proactive in addressing an issue which is a lot of times hidden away. Many persons so affected are reluctant to seek the help or intervention which could restore health and wellness. In closing, usually you get like a big round of applause. That's when you say a politician at a microphone with a captive audience, and I get to eat. Thank you. You're way too kind. In closing, I wish to thank the NCSA for once again being the forerunner in the field of drug demand reduction. And I have full confidence in your ability to assist organizations in both the public and private sectors with similar studies which can be used to craft their workplace drug policies, assist them in amending existing workplace drug policies, and inform drug education programs that will cater to their specific needs. I leave you with this quote from the American writer Dale Carnegie: "Do the hard jobs first, and the easy jobs will take care of themselves." Do the hard jobs first, and the easy jobs will take care of themselves. Employers, it must be your priority to take care of your staff. It's good for you, it's good for the staff, and it's simply just good for business. Please heed my words and help those who need the help. Thank you.
Thank you, Minister. We will indeed heed your words, and thank you for bringing this most important message to the fore. And we always appreciate when you bring your very important and relevant little sound bites, because it helps us to visualize the situation. And we really do appreciate when you can bring those little moments, little nuggets of wisdom to us. So thank you. At this time, we will now hear from our featured presenter. He is our Research and Information Officer here at the NCSA. And just to give you a little insight into his research background, not only does he manage, conduct, and facilitate surveys on substance use, drug addiction, and in some instances, correlations with HIV amongst the general population and other specific populations. But he also has a certificate of training in protecting human research. This is from the National Institute of Health in the United States. He also has a master's degree in criminology from the University of Leicester of the UK. And as recent as 2020, he would have received his PhD in Human Services with a specialization in criminal justice from Walden University. So at this time, to present and to provide that full overview of the pilot online survey report on the perceptions of public workers about drug policies, knowledge about drugs, and drug intervention services is Dr. Jonathan Yearwood, our Research and Information Officer.
I want to first start the introduction with a gratitude to the agencies who participated in the study. I see one of them is here, the Immigration Department, and thank you for being here. And to just continue on what the Minister would have spoke to earlier, that the abuse of legal drugs is a psychological and social problem that impacts society. For example, the WHO recognizes the disturbance or interference with mental and bodily health and the additional social ramifications of the effects of excessive drug use on the well-being of an individual and by those who surround individuals who abuse drugs. The type of drugs consumed or sold in Barbados range from the traditional alcohol, marijuana, and cocaine to the non-traditional substances of methamphetamine and ecstasy. However, as a preventive agency, such as the NCSA, we remain cognizant of the threat of other drugs that create havoc among drug users, including addiction and death from long-term use of drugs, including opioids, which are a class of drugs that include heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescription, such as oxycodone, hydrocodone, codeine, morphine, and many others. Now, data from the treatment centers in Barbados indicate that 884 persons were admitted to the psychiatric hospital during January to December 2021. But of those persons admitted to the psychiatric hospital, about 1/3, 35%, sought treatment for drug abuse. As in previous years, males accounted for most persons seeking treatment, with just under 2/3 age 40 and under. 88 persons were admitted to the Substance Abuse Foundation in 2021, the majority of whom were males 40 years and under. So I'm stressing this age difference, 40 years and under. The consumption and abuse of traditional and non-traditional substances can be detrimental to the workplace, as employees who abuse these substances may increase their likelihood of accidents, injuries, increased absenteeism, inappropriate behavior, and impose an economic burden on employers, governments, and society. Because most of persons seeking treatment for drug abuse are primarily under 40 years, this age mirrors the working age of a significant number of workers in Barbados. It is therefore important to ensure that our working population is provided with a well-grounded understanding about the various types and categories of harms related to substance abuse and the different forms of substance abuse behaviors that are detrimental to them, and their ability to function effectively in the workplace. Local and international findings also recognizes the link between substance abuse, NCDs, mental health challenges, and the need to make the workforce an attractive place for helping employees overcome their challenges with drug addiction and to improve their productivity. This study's focus is therefore not on the extent of drug use in the workplace that has been already established in our previous reports, but rather to explore how the workplace can be part of the network of support services that address and manage the long-term issues associated with substance abuse. Here the minister spoke about, we know about there's a culture of rum use and drugs, but what are we doing about it? A focus on support services for employees who abuse drugs builds upon the International Labour Organization guidelines that emphasize non-punitive rather than punitive approaches for dealing with substance abuse problems in the workplace. These approaches emphasize clear workplace policies on drug use, drug education, and support for workers addicted to drugs. It is within the context of the ILO approach to drug issues in the workplace that this study was conceptualized. This report is based on the results of an online pilot survey. It's the first in the country that, it was done during the height of the pandemic period, conceptualized in 2021, and the data was collected during 2022, early January 2022. And it was an attempt to collect data and not play dead during the pandemic, but to work and to find ways of collecting data even during the roughest periods of lives that the country was experiencing at the time. So the online study was a pilot study that we attempted to collect data that can allow us to pursue programs and inform policy on substance abuse. This report will cover the following areas. papers together. All right. It will cover the background of the NCSA, substance abuse related NCDs. Substance abuse disorders, comorbid diagnosis, we will get to explain those. Gaps in your workplace, drug prevention and treatment. The strategic role of workplaces in drug prevention and treatment initiatives. The purpose of the survey. We will talk a little bit about the methodology. Of course, the results, some recommendations for future research. Now, for those who may be online and not know of the NCSA, it was established in 1995 under the aegis of the Ministry of Home Affairs. We conduct drug education prevention interventions at the community, primary, and secondary school levels. We offer individual counseling for persons who may be affected by substance abuse or related difficulties. We also conduct research into the drug phenomenon. Now, multiple studies show that alcohol-related absenteeism is estimated to cost businesses up to $2 billion a year in Australia, $4 billion in the United States of America, 9 billion euros in the European Union. An abundance of research has found that employers who provide workplace policies on drugs and facilitate the drug education and treatment for workers addicted to drugs achieve greater worker productivity and reduce the costs associated with substance abuse-related illness. In Barbados, let's go back here one. Yeah. Now, in Barbados, the need for drug policies and information about drug addiction among workers is even more compelling, given the fact that Barbados has one of the highest rates of obesity, hypertension, diabetes, heart disease, and stroke linked to tobacco, alcohol, and abuse. And this is a study conducted in 2015 by Howitt and Company. And the country spends $64 billion, Barbadian dollars, million Barbados dollars, or approximately $220 per capita per year on cardiovascular disease and diabetes. Moreover, the Barbados economy is losing Barbados $145 million per year due to missed workdays, poor productivity, reduced workforce participation, and the cost of business of replacing workers from cardiovascular disease and diabetes. And this is taken from the WHO report of 2017. Now, I would just go back one here to talk about this comparison of Barbados' situation with the world. Howitt and all his company would have done this study, and they looked at 1,200. They captured 1,234 members of households in Barbados, 25 years and over. And what that study found was that there was a high prevalence of obesity in Barbados population, 33%, relative to the global averages of 10% in men and 14% in women. The level of obesity was similar to the USA, where obesity levels are around 35%, and were higher than those found in the UK, 26%, and Jamaica, 25%. Higher levels of hypertension in this population, 40%, than those observed in the USA and Jamaica, where hypertension prevalence is approximately 35% and 25% respectively. The proportion of Barbadian population affected by diabetes, 18%, is greater than the global average of 8%, as well as national levels in the USA and Jamaica. So this just to give us some type of information pertaining to what Barbadians, adult 25 and over, are experiencing. And I talk about a mirroring of the work population. So I'm building my case for our study. Now, I can just give a little background quickly about the drugs available in Barbados. And these drugs centered on crack cocaine, marijuana, alcohol. These are either used singly or in combinations. Now, some of the more recent developments worldwide are reported deaths resulting from the abuse of opioids. This is probably prevalent in the United States, including experimentation with fentanyl and methamphetamine. And methamphetamine, you know, we would have, thanks to the minister, he would have highlighted the importance of getting information about the risks associated with methamphetamine. Two dangerous drugs, particularly when used with adulterants, including ephedrine, ketamine, and cocaine. We also have the issue of polydrug use, which is a more recent development. The term polydrug use is used to describe the use of more than one drug or type of drug by an individual either at the same time or sequentially. It encompasses use of both illicit drugs and legal substances such as alcohol and medicines. Persons who consume multiple drugs are more difficult to treat, as specific combinations of substances may present a greater need for intensive interventions. Moreover, treatment practitioners may require adequate training to explore and apply a range of modalities to reduce addiction stemming from polydrug use. So I'm making the case that polydrug use can also create problems in terms, not only in terms of health, but cost to the medical system. Now, the need of, we just mentioned the emergence of methamphetamine and the emergence of ecstasy, and these have similar effects to drugs such as cocaine and heroin. Now, the need for these mixed drugs, when persons begin to use more than one drug and develop problems associated with what we call substance use disorders and comorbid diagnosis. Just to give a definition of substance use disorder is that it occurs when the recurrent use of alcohol and or drugs causes clinical significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, or home. Now, the comorbid diagnosis is a little bit more extreme to the substance use disorder. It refers to the occurrence of two or more disorders or illnesses in the same person. And to give some, we were talking, a lot of conversations on the radio centered recently on mental illness and its links to substance abuse. But I'll give some data in relation to the mental illness and substance abuse link. In 2018, just over 2 out of 10 of the psychiatric hospitals admissions were for comorbid diagnosis, including substance use disorder. In 2019, that went to 33%, came a little bit down in 2021 to 24%, and when we see everything moving from 2018 to 2021, males rather than females, and the population under 45 years. So here we're talking about under 40, under 45. Workforce, significant population. Now, what are the gaps that we need to fill, or what we need to consider when we are addressing problems in the workplace in relation to substance abuse related concerns? Now, there are few generic health promotion programs in the workplace that comprehensively address substance abuse issues. You may get one off, but in terms of having this comprehensive approach, holistic approach, there are few. Drug testing and employee assistance programs do not holistically address current substance abuse issues in the workplace. the minister talked about some individuals who were hesitant to report substance use issues. Workers may hesitate to participate in programs that test them for drugs because of fear of potentially negative social, professional, legal, or financial consequences. Fear. Personality traits contributing to a worker's professional success, including independence, perseverance, self-reliance, may make workers resistant to asking for help. However, evidence supports the efficacy of drug education initiatives within comprehensive workplace-based wellness programs. Now, the ILO also provide, especially for persons who work with labor organizations, employer organizations, the ILO guidelines on workplace policies on drugs suggest that workplace drug policies should provide written guidelines on drug use and efforts to reduce alcohol and drugs among employees through education, information, help, and support. So we are on good ground. The ILO also contends that drug testing for employees must adhere to confidentiality standards that protect the rights of employees and ensure the privacy of test results. In Barbados, public sector employees are generally not lawfully required to test for drugs, but government and private sector entities can prohibit the consumption of alcohol and other drugs in the workplace. The minister have it. Okay. Now, the workplace, there's a strategic role for reducing substance abuse in the workplace. One, the public sector employs a significant number of adults in Barbados and represents the highest government expenditure on labor. Employers have a duty under health and safety laws to protect the health, safety, and welfare of employees and others affected by their activities, according to the Shaw Act of 2013. Workplaces can provide health education about alcohol and drugs and identify and refer individuals who have problems with alcohol and drug use. The workplace also has a potential role in supporting the social reintegration of those with a history of severe drug problems. And that brings us to the role of the NCSA. Now, how can the NCSA make a difference? To address drug abuse-related issues among workers in Barbados requires the collection of data that can inform substance abuse interventions. And that is why we proceeded with a study of this sort. And the purpose of this survey, which we'll talk to, so we don't get sidetracked about what it is we are actually doing, the study is a pilot project that aims to collect data on the perception of public sector workers about workplace drug policies, knowledge about legal and illegal drugs, employer support for workers with substance abuse problems, and the importance of drug education and treatment services to workers. Findings from the survey will allow for the crafting of workplace drug policies that support initiatives that addresses drug addiction and improve employee well-being and productivity. Now the methods, back there. Now the survey was conducted online and we used a software called Question Pro. We targeted 304 persons that were randomly selected from among a total of 1,624 attached to 9 departments under the Ministry of Home Affairs. We were 95% confident that the samples selected would have been a true representation of the 1,624 persons that we tried to reach. Data was collected between January 24th and March 4th, 2022. And that's how we set out. That was the design. But We have some issues with sampling and the selection and the collecting of data. The number of responses was far less than initially anticipated in the design of this study. The study is online. It was done during the height of a pandemic. Workers were coming in 1 day in, most days off. They have most days in, a few days off, some hours in, some hours off. So we had that type of environment that was not really conducive to the motivation. People had other priorities to think about. That could be one of the reasons. Now, 72 persons would have completed questionnaires, given a response rate of 24%. So we said, boy, that's low. However, it fell within the acceptable range of responses of between 5% and 30% using online methods to collect data. And what we can take from it as well is that 7 out of the 9 departments participated in the survey, despite the reduced responses. So across the board, we had that wider participation. Descriptive statistics were first used to give an overview of the participating departments, job categories, length of service, demographic variables. Second, participants rated their level of agreement with a series of statements and questions based on a Likert scale of 1 to 5. 1, strongly disagree. 2, somewhat disagree. 3, neither agree or disagree. 4, somewhat agree. 5, strongly agree. The statements and questions were on the following: workplace policies on drugs, adequate information on drugs and drug treatment, the importance of drug education and treatment programs for employees, participation in drug education and treatment programs in the workplace. Most of the participants came from the Barbados Postal Service and the Barbados Prison Service. The categories of worker were primarily in the mid-level supervisory, as well as persons who worked as clerks, messengers, secretaries, receptionists, and basically administrative personnel. There was also some senior officials who also participated in the survey. Most persons that participated had a very long time of employment, ranging from between 11 to 30 years. With most of them, the majority of them, would have between 16 and 20 years service. The majority that took part in terms of gender were female rather than male. Most of the workers fell between 35 and 45 years. And the first question, are you familiar with workplace policy on drugs? And yes, the majority of them would have agreed, between somewhat agree and strongly agree, but you will find that the majority of them would have agreed that they were familiar with workplace policy on drugs. However, when you ask the question, do you understand my workplace policy on drug testing now? Although the majority, say around 42% or so, 48% would decide that they agreed, that they understand. You still had about 30% saying that I strongly disagree. I do not understand the workplace policy on drug testing. While there was a significant number of 22% neither agree or nor disagree. So we are neither here nor there in terms of understanding drug testing. But is drug testing mandatory in the public sector? However, in the prison service, I understand that persons entering the prison service need to go through a drug testing routine prior to becoming employed. in the prison service. Police. Okay. Well, the police weren't in this thing, but this is more relevant now for the prisons. They're not sure about understanding what are the intricacies of drug testing. So yeah, you look at that again. Right. Do you feel a workplace policy on drug use is essential? Now the majority, almost 90%, said yes, out flat. They agree that there should be a policy. Second, the other question was, do you have adequate information on drugs? Now the majority would have indicated yes, that they have adequate knowledge on alcohol, tobacco, marijuana. Now, when it comes to cocaine and opioids and methamphetamines and amphetamines, we saw that there were reduced amounts of those persons saying that they have, fewer persons saying they have adequate knowledge about those drugs. And we're talking about opioids, meth, amphetamine, cocaine. Just tells that we at the NCSA have a little bit more work to do to ensure that we can create that further education and understanding about these harmful substances. I don't want to ask my doctor if I am being prescribed a painkiller. Now, most persons say yes. However, you see, the question is a yes, no, quantitative, and that range of responses. We didn't find out from them what do you understand by a painkiller. Now, a painkiller could be a Panadol. Sorry. A painkiller could be a Panadol, okay? But as I mentioned earlier, painkillers can range from opioids, including heroin and fentanyl that is rampant within the US, that can lead to long-term addiction and harms related to the use of these substances. So I guess when persons go before a doctor, they say they want something for the pain, they want something now. We're not going to ask the doctor if it has any long-term effects or whatever. I just want the easy pain. So again, in terms of education, institutions of the NCSA has a role to play in providing that type of information about the risks associated with the different types of drugs that persons may consume, whether legally or illegally. Knowing how to find information on pain management. Again, most of persons would have strongly agreed, yes, they know where to find information on pain management. I know how to find information on treatment for a substance abuse problem. And most of them would agree, yes, they know where to find information on treatment, which could be a good thing. I know where to seek help at work if I think I need help for substance abuse. And most of them would have agreed, yes, they knew where to seek help for work. However, we had 24% that say that they disagree with that they did not know where to seek help at work if they thought they had, or they thought they needed help. And this is one that really struck out to me. I would be scared or anxious I would lose my job if I disclosed I had a substance use problem. Yes, the majority, close to 50%, would have said, yes, I would be scared to lose my job if I disclosed to my employer that I had a substance abuse problem. Further, 23% were neither here nor there. I am confident that my workplace will support employees with substance abuse problems. Again, what we saw here is that yes, there could be a slight 42% said yes, they agree. But 30% were neither here nor there, that they will be confident that that the workplace will support them. Well, 28% did not agree with that at all, that the workplace will support them. Then we came to finally to the importance of workplace programs on drug education and assistance with substance abuse problems, how they were perceived by workers. Most of them would have said that, would have strongly agreed that drug education programs were important in the workplace. Assistance to workers with substance abuse problems were important. Participation in drug education programs were important. Participation in programs that assist workers with substance abuse problems, were also very important. Let me just shuffle these papers out of the way. Right. Now, what were the key findings? Just to summarize, the key findings. Most respondents were familiar with the workplace policies on drugs and believe that a workplace policy on drugs is essential. Most agree to that. Less than half of the respondents understand workplace policies on drug testing. Most respondents agree they had adequate knowledge about alcohol, tobacco, and marijuana. Fewer respondents reported having sufficient knowledge about cocaine, opioids, methamphetamines, and amphetamines. 7 out of 10 respondents agree that they know what to ask their doctor about a prescribed painkiller, with fewer unsure about finding information about such medications. 6 out of 10 respondents agreed that they knew where to seek help at work for substance abuse problems. Half of the respondents agreed they would be scared or anxious to lose their job if they disclosed a substance abuse problem. Only 4 out of 10 respondents agreed that they were confident the workplace would support them if they had a substance abuse problem. 3 out of 10 respondents were neutral to whether they agree or disagree on support from the workplace upon disclosure of a substance abuse problem. Most respondents agree that interventions in the workplace are essential, including drug education and programs that assist workers with substance abuse problems. Most respondents agreed that participation in drug education and treatment programs are important. Now, what can we talk about? Some recommendations. This is what the minister always asks about. How can we approach the problems? First, we can look at the standardization of workplace drug policies on drug testing. And taken from the ILO, the International Labour Organization, suggests that workplace drug policies should provide written guidelines on drug use and efforts to reduce alcohol and drugs among employees through education, information, help, and support. As I said, following the ILO guidelines, and the persons here who are affiliated to labor organizations, I'm sure that they will be familiar with those guidelines. The ILO also contains that drug testing for employees must adhere to confidentiality standards that protect the rights of the employees and ensure the privacy of test results. Now, as I mentioned before, in Barbados, public sector employees are generally not lawfully required to test for drugs, but the absence of a policy on drug use in the workplace may hinder efforts to reduce substance abuse and increase worker productivity. Now, encouraging government and non-government entities to invest in developing drug policies should therefore be a priority. 2, encourage the promotion of non-punitive approaches to drug policies that facilitates recovery-friendly workplaces. If you hear that word, friendly, recovery-friendly workplaces. Now, one key component of making workplace drug interventions attractive to employees and employers is the creation of a therapeutic workplace community. The therapeutic workplace community is a novel, long-term, employment-based intervention designed to address the chronic nature of drug addiction through a contingency management intervention that promotes rewards for abstinence from drug use. Contingency management interventions are rooted in research that suggests drug addiction can be modified through incentives for drug abstinence and maintaining abstinence from most abused drugs. A reason for the success of therapeutic work community is that money or monetary incentive can be attractive to most people. Give them some money and abstain from drugs. If you test positive for drugs, then the monies will stop. However, such incentives are only effective if they are attractive to workers and sustained through well-managed and implemented workplace policies on drug use. Reduce workers' hesitancy to disclose information about their drug problems through work policies that emphasizes confidentiality. Now, only 4 out of 10 respondents agreed that the workplace will support them if they had substance abuse problems. More concerning was that 3 out of 10 were uncertain whether they agreed or disagreed on the issue of confidence in receiving support from the workplace upon disclosure of a substance abuse problem. Now, the literature would have indicated that worker fear of disclosing a substance abuse problem suggests that there is a fear of negative fallout. However, evidence also shows that employers can reduce worker hesitancy to report drug-related problems through a comprehensive programs and drug policies that also includes confidentiality. Incorporate alcohol and drug education and treatment interventions in the workplace into a comprehensive health promotion program. As indicated, few programs comprehensively address substance abuse issues. For example, researchers have also said that effective drug testing and employee assistance programs do not holistically address current substance abuse issues. Moreover, complex drug-related problems, and drug-related problems are complex, are likely to go beyond the scope of our employee assistance program. And one of these reasons is that employees may hesitate to participate in such programs to test them for drugs. However, the evidence supports the efficacy of drug education programs and practices within a comprehensive alcohol, drug, and other workplace wellness programs that address workers' hesitancy, along with the wider services that help workers overcome their challenges with drug use. Sensitivity about drug testing. Now, less than half of the respondents understand the workplace policies on drug testing. This is not surprising, given that the workplace drug testing is relatively a new worldwide phenomenon, migrating through multinationals from industrialized to developing countries. As public sector employees are generally not required by law to test for drugs, the lack of understanding of workplace policies on drug testing has implications for mandatory or otherwise drug testing in the context of the laws and regulations of Barbados. However, a greater worker understanding of drug testing, its purpose and practice, signals a need for more education in the workplace regarding workplace drug testing among all levels and categories of workers. Support for drug prevention efforts. Overall, most respondents agree that drug interventions in the workplace are essential. However, addressing workplace policies is a national undertaking drawing on the resources of well-coordinated response to increase productivity within the context of the existing health structure. Such a national response should be ongoing and standardized within public and private sector organizations to ensure quality in the delivery and access to services. More importantly, such a national response can be driven and coordinated by us here at the NCSA in helping private and public sector HR departments with the crafting of programs and initiatives to improve workplace policies on drugs, provide critical information about the harms of substances, and create opportunities for workers to receive treatment for drug addiction. I will just conclude with giving some future research. Now, one of the critical features of reducing risk to public health among workers is the ability to access information on various drugs they will use for medical purposes. Most of these medicines are prescribed according to standard practice. Let me just work from here. We should need to look at, yes, most of these medicines are prescribed according to standard practice and guidelines, often for a limited period to relieve pain, insomnia, or to deal with surgical or other trauma. Despite the value of these medicines to health, the misuse of prescription medicines is an increasing pathway to drug addiction as individuals seek to relieve pain. Therefore, accessing the information on prescribed drugs is crucial, given the link between prescription drugs, substance abuse, and drug addiction. Consider strategies to ensure greater interest and participation in online surveys. Now, one of the critical issues from the survey is the ability to increase broader participation. However, the response rate for this survey fell within the accepted range of 5 to 30% for precise estimates. Future studies should try to increase participation through incentives to participate in the survey. Now, though incentives do not guarantee a boost in the online survey response rates, prepaid monetary incentives might increase the response. You need to consider the use of qualitative and mixed methods. And the reason why we're talking about qualitative and mixed methods is that it's very difficult and challenging to approach adults, particularly in the workplace, and to speak about, ask them whether they use substances, whether legal or illegal. What we're saying is like, it's even challenging to go by queue in the community and ask the persons down there whether they use alcohol. You know, you tell boy, go back where you come from, you know. But persons may be more inclined to talk about an issue, or talk about their experiences, talk more about what has driven them in a particular direction, talk to them about the existing culture and whether it makes sense to even talk about rum and alcohol use within the existing structures. Talk about the issues that they face, whether the psychological issues they face, the social problems they face, the family structure. All of these come together to give a picture of the whole person. But we can't get that information from asking yes or no questions that are related to quantitative approaches. So that's why I said we also need to look at other ways of gathering information that can give a truer picture of what it is that we are seeing. In conclusion, the findings from the survey provided valuable data to inform training curricula for public sector workers. In particular, the study showed that workers could offer opportunities for a well-designed, that workplaces could offer opportunities for well-designed drug policies and services. Approaches to drug-related issues at the workplace are subject to Barbados' various administrative, legislative, labor, and cultural issues regarding the use and abuse of legal and illegal substances. The successful implementation of a training plan for public sector workers should therefore be consistent with and supportive of existing labor and cultural practices. And that's the end of my presentation. If there are any questions, I could respond to. Probation is also here. Okay.
Sorry. Sorry about that. Yes. I wanted to find out. I wanted to find out if they. I'm having a laughing fit. Sorry. I wanted to find out if you could give a reason behind the low participation rate.
Well, I mean, sorry, yeah. We can speak about many reasons, all right? And, but generally speaking, online approaches suffer from low participation rates. As I mentioned before, between 5 and 30% is an acceptable range for online responses. Within the context of the low responses in Barbados, though, we were in the midst of a pandemic as well. And data collecting within that period would have been somewhat not supported with face-to-face processes for collecting data for all those reasons. Now, as you know, if you go and I do a face-to-face, I go to you, particular time, I can get that response. Even if I miss you at a particular time, I can probably get you another time. So you will still be included within the sample. So the chances of getting a higher response, a higher number of participation, will be a little bit higher, but not much higher with face-to-face responses. But we were in the midst of a pandemic, and that may probably be one of the reasons, because associated with the pandemic was the motivation of workers to actually focus on work-related issues during that time. I'm not blaming on the pandemic, but what I can say that despite those limitations, we still fell within the range of what is considered to be acceptable. And yes, going forward, without saying, well, you know, we owe the pandemic, so should we get rid of the online approaches? No, I don't think so. I think we should build on the technology. We spend a lot of time, the pandemic has encouraged us to think about technology and the use of technology. Yeah, see, I say use that opportunity. And it could be a model for other countries, for other departments that's seeking to also to conduct such studies. So here at the NCSA, we looking to build on those approaches. Get better at them. The only way you get better is if you do. You can't get better if you don't do. And then, so again, there may be, as I said, many factors inside there that may be responsible for the low response rate. Mm-hmm.
So, I thank you for that question. You more than you can possibly imagine, because it allows me to step through a door that you opened. Look, Bajans on a whole are very suspicious of surveys and questionnaires. When you mention surveys that have to do with drugs or something illegal, then people start to believe, especially when it's online, that you can track who it is that submitted the response. So if they start to fill out, in the back of their mind is the thought that my employer might know who this is. It then in some way also skews some of the answers, but that error is calculated into how you process and how you arrive at your conclusions. So if we're honest with ourselves, as we need to be honest in these fora, when you get a blank piece of paper, you are more likely in looking at it, take off, if you know you don't have to put your name on it, and then drop it in a box. That same willingness does not operate when you have to log in an email back or something and they feel they can track you to your computer, right? So anonymity is the key to getting the response. The other thing as well, yes, we had all of the COVID issues and nobody really wanted to participate in anything during COVID. People didn't want to hear about it. So for the next one that you do, and I'm assuming there's going to be a next one because we can only properly assess the accuracy of the data by doing multiples. We might need to work with JS, with the media houses, to say that the NCSA is doing this survey, right? So you may get an email from the NCSA or those persons who are willing to participate in the survey, please contact us. The findings will be used for X, Y, and Z, and confidentiality guaranteed. If we actually put that out, it A, lets people know the NCSA is doing stuff. It B, sensitizes Barbadians to the fact that this may happen. It gives them a reason to trust what it is that's going out. And we encourage wider participation. So that's just food for thought.
Yeah.
So I'm glad that you asked that because you opened the door that I was able to step through. Thank you.
Yeah. Well, thank you, Minister. In our preparation, we have had multiple discussions with the participating agencies and stakeholders. And yes, we did talk about confidentiality and confidential issues, particularly in the reporting format. It was said to be very confidential, and no names were used. And each questionnaire had a number. So there was full attempts to avoid any names, and that was discussed with the participants prior to the survey, because it did come up. Somebody could track me, right? So it did come up, and we did put measures in place to limit that as much as we can.
We give an idea how soon then we'll be looking to get policies put in place, perhaps? Well, first from the NCSA, with the recommendations and everything forward now,
right?
What lobbying methods will you be pursuing to get policies in place, because you've seen a need? And for the minister, how soon then can we expect work to begin?
Betty,
Good afternoon. Thank you for your question. The NCSA actually has already started assisting both public and private sector workplaces with crafting policies. These are workplaces, I would say they are large, employ a large number of employees. We consistently say that we're here to assist with doing this. So with respect to the NCSA, putting ourselves out there and offering to help on persons, workplaces, employers taking up that offer, yes, we have already started doing that, and I speak of quite recently, and it is encouraging. As Dr. Yearwood would have mentioned, when we do that, we take into consideration ILO guidelines and national guidelines. We also recognize there's in place a national wellness policy which speaks to drug use, even if it is a cursory reference. We are in the process of revamping a national drug plan, and we hope from that, down the road, when that is buttressed with the other surveys that you have just mentioned and that was just mentioned, once we have enough credible evidence and credible data to build on that, that is when then we ask our minister to get involved, see what we have sent to him, see how that you can incorporate that either in existing policies, or if there's a need to build out a standalone policy on drug use in the workplace, and then ministry will take it from there. So yes, the NCSA has already started. We've put it out there, and we have already started. And I'm pleased with the type of requests that we are getting and the type of agencies that we have assisted in crafting their workplace policies.
What she said. So let me stand up for this one. So I'll say this. Since NCSA fell under my portfolio, a lot of things that I would have heard of before, and you take note of it, but you don't necessarily take action on it, I am now taking very, very seriously. Because it is no longer background noise for me. I come here and sit down in this room every time a report is being done, every time a policy accommodation is being sought. I wish sometimes Betty would lose my phone number. All right? But the fact is that because NCSA falls under me, I know a lot of things and I pay attention to a lot more things than I otherwise would have. And it is incumbent upon us, not just as a government, but also in relation to the private sector or anybody that has a business, to have policies in place that cover all the things that we can contemplate. It eliminates that gray area. When you don't have a written rule or a stated policy, then things can fall through the cracks, behaviors can be excused that may escalate into something else, or persons, if they're caught doing something that they know they shouldn't do, would say, but there wasn't a policy. Nobody told me you couldn't do that here. So, because of the issues that we know surrounding drugs, because we know that meth is in Barbados, because we know the opioid usage is increasing, because we're getting cold hard facts in relation to alcohol dependency or substance abuse, or even the prescription drugs, illegal medication that persons are abusing, because we're now being provided with the empirical evidence. When I spoke a number of times, I spoke and I said anecdotally, because we know it happens. But I can't tell you 10 or 11 or 12 or 20. Every time we do one of these reports, or every time we do one of these surveys, we come that much closer to concretizing what the actual evidence is. And the more information we have enables us to design the more appropriate programs and to provide the effort and the resources and the solutions where they are most desperately needed. So, it is my wish that following on this, which was exceedingly sound, and I please allow us to give a round of applause. That was an exceedingly thorough survey, analysis, presentation with the recommendations for the way forward. We accepted we were limited by sample size and when it was done. There is no excuse now for NCSA to not build on there. We have the questions, we have the analysis of the data set that we've collected so far. What we now need is a much wider data set to give credibility to the survey that was done and the recommendations that are being put forward. Once that is done, I have no difficulty in moving very quickly to ensure that the appropriate programs, policies, policy directions, and protocols are put in place to control that in the public sector. I also will not stop there because, quite frankly, it affects us all. Each one of us knows somebody who abuses substances. Each one of us in here. And when I'm saying I see you all nodding, because as I say that, you are thinking of a particular person. You can picture somebody who fits exactly what I'm saying about what I'm speaking about now. And if that person is at work, and that person's at work under the influence or well affected, that person is a danger to somebody else. Let us not wait until something real serious happens to then be trying to close that barn door after the horse has bolted, right? NCSA, you are on the front line. You are the stable manager. You're the person who locks that door and keeps that door locked. It is the duty of NCSA. And you have the capacity, you have the personnel, you have the skill sets, you have the heart, you have the vision, you have the leadership, and you can keep going at all the things and the attributes I see in here to get it done. So I applaud you for this. I am standing by to applaud you for the next one. And I'm standing by for your call. Because as soon as I get that call with your data set, right, then believe me, your government will our government, I like that, will move fast to do what it has to do. All right? So you said immigration was in on this one? Yes. When you're ready to go again, and it shouldn't be difficult to start to go again, I will tell you, go again immediately. Right? We will get the message out across the entire public sector and start to pitch it out to all of the other ministries. Right? I believe that the information is going to be affected not just by the levels, so we had a fair amount of persons in stable jobs, right, as opposed to temporary jobs or ad hoc jobs. We didn't have a good representation, I guess, from the labor side of it. And anecdotally, I say no more, right? So we have the parameters that have been set, and I actually see that in pretty short order. And I'm putting the charge on you all, I'm putting the challenge to you. Come back in short order. Come back in short order with more results and more accurate information. And as I said, we will then do what we have to do because we need to take this matter in hand. I don't judge people, but today, you all would have seen, you would have heard that somebody tried to rob Shore Pay in Cape Shepherd upstairs on the 3rd floor, down in the back. I don't know where he thought he was going to run to or how he thought he was going to get away, but everything is not as it seems with that case, right? So please, let us do what we can to help protect people from themselves. Thank you.
Okay, are there any more questions? No? Okay. Okay, your slide didn't come up there, you know, with me. It's a different thing, okay. All right.
Indeed, a very excellent job done by Dr. Yearwood in bringing the findings to light. And of course, to whom much is given, much is expected. And we certainly will heed your words yet again, Minister, and take charge, as we do at NCSA, of that data collection. And we are also very appreciative of all of the work that has gone in to making today possible. And to provide closing remarks and thanks is none other than our Deputy Manager, Mr. Troy Wickham.
Good afternoon. Good afternoon. Okay, fine. Everyone that is a little restless or tired. I know it has been a long afternoon. But thank you, Jonathan. Thank you, Paulovette. The Honorable Wilfred A. Abrams, NP, Minister of Home Affairs and Information, Ms. Yvette Goddard, Permanent Secretary, Ministry of Home Affairs and Information, Mrs. Karen Bass, Permanent Secretary, Ministry of Labor, Social Security, and the Third Sector, Mr. Curtis Jilts, Deputy Permanent Secretary, Ministry of Home Affairs and Information, Mr. Hadford Howell, Chairman of the Board of Directors of the National Council on Substance Abuse, Reverend Selvin Braffick, Deputy Chairman of the Board of Directors, NCSA. Members of the NCSA Board of Directors, Mrs. Betty Hunt, Manager, NCSA. Heads of departments, staff, and volunteers of the National Council on Substance Abuse. Specially invited guests, members of the media, ladies and gentlemen, good afternoon. Let me start by thanking the presenter. For a very informative and interesting session this afternoon. I'm certain that everyone was intrigued, as I, to learn about the workers' knowledge and harms of substances and the employer's support for workers with substance abuse problems. As you know, research is one of the cornerstones of our work here at the NCSA. It's vitally important for an evidence-based approach. We therefore are committed to increasing the number and frequency of our research projects to ensure the data is current and reliable and available to policymakers for programs and projects. The just released Workplace Survey Report is but one of a number of projects on the NCSA's research agenda. Our next step in terms of this working population will be to conduct similar studies which will afford us the opportunity to develop and craft specialized interventions with various organizations. This correlates to what the minister was saying before. We plan to conduct similar research projects for various organizations to help inform policies, drug education programs going forward in the near future. The NCSA will soon releasing findings from a research project which investigates the barriers to treatment for women in Barbados. As you may be aware, men far outnumber women in our treatment centers, and our research department has designed a study to investigate the reasons behind this. The ultimate goal of this study is to increase women's use for treatment services locally. And of course, the Barbados Drug Information Network, better known as BARDI. Data collection for the 2022 calendar year is on the way, and we hope to have this report ready and completed for release by January 2024. And you can applaud now our research department for their efforts. So as you can see, the research department has much in store for us over the coming months. You can now therefore expect to be invited to many more sessions such as this. So I expect to see you in the near future. Before closing, I would like to highlight some things that the minister mentioned earlier in his remarks. We see the NCSA as a judgment-free space, and we hold it dear to our heart, confidentiality, and encourage persons who have been impacted and their families negatively by substance use or abuse to contact us. We're here to help. We're here to offer assistance. We see ourselves as the authority in Barbados for drug demand reduction. I know we have specialized and skilled persons here on staff. We are always willing to help. We are not judgmental. So I encourage persons to reach out to the NCSA. Addiction is a disease. It's a long, long road. We have a long, long road. You will fall off the railroad, and we will help you back onto the tracks. We will. We are here to help. We are caring staff, very caring, and we are bright. Our orange shirts. We are orange shirts. We are bright. And we have 2 projects, specialized projects coming in the near future. They're public relations projects, and we are attacking this whole thing of alcohol consumption frontally. We have a project which will focus on women. I know recently in the media persons mentions women being slip mollies in the drink. This is crop over period, and persons may try to take advantage of the female population. So we have a campaign coming very shortly to inform persons about the dangers and what to look for when they're in parties and alcohol consumption. Right now we have a radio program running. Know Your Limits is a 15-minute radio program on the urban radio stations. We are on 98.1, we're on Hot 95.3, we're on VOB, and we're on Slam. So stay tuned to those stations. You will hear valuable information on alcohol consumption. And we also have a campaign which speaks to highlight binge drinking, what binge drinking is, a standard drink, in terms of how persons should look out for, especially in this festive period. So we are trying to be on the cutting edge of drug demand reduction, and we need the support of the public and the media especially. Highlight the work of the NCSA, or reach out to us, even reach out to Troy, I'm the deputy manager here. Ask questions, try to find out what we are doing, who we're trying to assist. We are here to help, as I said before. Before closing now, Dr. Jonathan Yearwood, the survey coordinator, had asked me to recognize a number of persons and departments that enable this workplace survey to be a success. This includes the Minister, the Honorable Wilfred A. Abrams, MP. Give him a clap. Thank you, sir. The various heads of departments under the Ministry of Home Affairs and Information, they were integral in this survey. They allowed us to engage their staff. Though the response rate was a little low, we still got some information that can assist with our drug education and assist us with policies, give us above the surface bird's eye view of what's happening on the ground, especially in our ministry, and that's important to us. They say horn drums beat first. So we beat in our horn drum, Ministry of Home Affairs. Again, a special thanks to must also be extended to Mr. Mark Challenger. He's the Vice President of System Consulting Limited. He is integral in facilitating the online element of this survey, the first of its kind for the NCSA. It was a learning curve for all of the persons involved here at the NCSA. First of its kind. We used Question Pro. We had some challenges. I must say a special thanks to Mr. Eiffel, our technician. Many days. Many days, Mr. Eiffel had me a deep conversation trying to understand the software tool and allowing persons within the ministry to gain access to the survey instrument. Jonathan and myself and Timothy and Mr. Chan had many meetings. So I must thank him for obviously facilitating that process. And lastly, give him a clap. Thank you. Lastly, but by no means least, the staff of the NCSA. Who assisted in any way you could during the research process and the preparations for today's events. It's certain that your assistance throughout the project was greatly appreciated. I will leave you with a quote now. From a famous speaker and author, she was blind and deaf. And this is Helen Keller. Alone, we can do so little. Together, we can do so much. And this is important to me. Teamwork makes the dream work. So thank you. I expect to see you soon and have a wonderful day. Good evening. All right.